Good morning, class. I am Reem Aldeek, and I'd like to welcome all of you for today's lecture on the common types of local anesthetic techniques utilized in dentistry. So, as you must know by now, local anesthesia plays a vital role in pain management during dental procedures and to ensure, of course, patients to receive comfortable and stress-free care. So now let's delve into the various techniques that dentists employ to achieve effective anesthesia. So first we have is infiltration anesthesia. This technique involves injecting the anesthetic solution directly into the tissues surrounding the targeted tooth. So commonly this is used for procedures that involves a single tooth or smaller areas of the oral cavity, and ideally for superficial procedures such as tooth fillings, crown preparations, and simple extractions of the anterior teeth. So next we have is topical anesthesia. So before we administer with injections, dentists often apply this topical anesthetic cream to the injection site to numb the surface tissues. This this topical anesthesia is available in the form of gels, sprays, or creams, and it helps alleviate discomfort associated with needle insertion. Now let's start off with the mucosa and submucosa local anesthetic technique, which is commonly used in dentistry to provide anesthesia for procedures involving the soft tissues. It involves injecting anesthetic solution into the mucosal layer and the submucosal tissue to numb the area. This technique is particularly useful for procedures like biopsies, suturing, or other minor surgeries involving soft tissues of the oral cavity. Next we have is intraosseous and truncular. The intraosseous technique involves injecting the anesthetic solution directly into the bone, typically the alveolar bone surrounding the tooth. It provides rapid and profound anesthesia, making it useful for procedures such as extractions or root canal treatments. While the truncular or truncal, this technique involves blocking larger nerve bundles that supply sensation to a specific region of the mouth, such as the maxilla or mandible. By targeting these nerve bundles, dentists can achieve comprehensive anesthesia for larger areas, making it suitable for procedures like multiple extractions or extensive restorative work. Both techniques have their indications and advantages depending on the nature of the dental procedure and the patient's needs. Now lastly, we have is intrapulpar and intraligamentary. For the intrapulpar, this technique involves injecting anesthetic solution directly into the pulp chamber of the tooth, which is typically used when other conventional methods of anesthesia have failed, such as in cases of irreversible pulpitis or highly inflamed pulp tissue. By delivering the anesthetic solution directly to the pulp, profound anesthesia can be achieved, allowing for more comfortable treatment, while intraligamentary, also known as periodontal ligament injection, this technique involves injecting the anesthetic solution into the periodontal ligament space around the root of the tooth. It's useful for achieving localized anesthesia for specific teeth without affecting surrounding soft tissues. Intraligamentary injections can be particularly beneficial for single-tooth anesthesia during procedures like extraction or endodontic treatment. Now class, so now you must know that local anesthesia techniques, in dentistry particularly, are diverse and tailored to meet the specific needs of each patient, of each procedure, of each case. So by understanding the common types of local anesthetic techniques that are available, it will be great for dentists that can assure effective pain management and enhance the overall dental experience for the patients.